Hello, namaste. Good evening from India. My name is Ira Sahay. I'm a dLife-certified practicing metabolic health consultant, also the chief operating officer of dLife Healthcare Pvt Ltd. A bit about dLife. It was founded by the maverick and genius, as we call him, Anup Singh, a silver medalist engineer from India's Ivy League institution, IIT Roorkee. Anup was diagnosed with type 2 diabetes in 2011, and he refused to go down the pills path. He gave the template of 100-gram carbs per day max or 20-20-60 in 2012 after having followed it for 1 year himself already. He also made a marked distinction saying Indian low carb is not the Western keto that made not only low carb sustainable and doable, but also made diabetes remission possible for even Indian vegetarians who largely have, grain-based plates, in their meals. He's now a pill-free 15th year diabetic and was given the Icons of India Award in 2022. DLife is India's first and the world's biggest low carb platform. It has been reviewed and widely recommended by global low carb stalwarts like Dr. David Unwin, Dr. Gary Fetke, David Diamond, and many, many more. You can see them on the DLife front end. It's all posted there. With over 2,000 plus original Indian low carb keto recipes with hundreds of documented success stories of remission. That's low carb D-Life Forum for you. In 2020, Anup launched the D-Life Diploma course that's now the only course approved under the government of India and is also the biggest course in the world with the biggest CPD hours of 144 that no other course in the world has. Enrollments to the course are from 21 countries. It's a course that trains even mainstream doctors in TCR. The D-Life Forum and the D-Life course both stand as the gold standard of low-carb nutrition, resource learning, and certification in the world, especially for the vegetarian folks. A bit about Dr. Robert Cywes, our very esteemed guest. Dr. Cywes is also known as the Carb Addiction Doc. You must have watched his videos on YouTube. I keep watching them. He's a dual board certified surgeon specializing in obesity, metabolic health, and carbohydrate addiction. With an MD from the University of Cape Town and a PhD in carbohydrate metabolism from the University of Toronto, he has performed over 8,000 bariatric surgeries. That's whopping. Dr. Cywes believes obesity is rooted in addiction to carbohydrates, not a lack of willpower. His approach combines low carb nutrition with behavioral therapy to treat the root cause. He's a prominent speaker, educator, and advocate for sustainable metabolic health through carb restriction and psychological support. He was a guest speaker at the third Metabolic Health Conference organized by Anup and Shashi. Welcome, Dr. Cywes, and what a pleasure to have you for the first time on the D-Life podcast series.
Thank you very much. As we were talking beforehand, I am in awe of what you guys have done in India and across the world. So I use, even though I've been in the field 20 plus years, I use your message quite a bit in my own practice. And we're very dynamic and changing. So I'm thrilled to be here and talk a little bit about certain concepts that will advance what we all do collectively.
Yeah, thank you for being here. And we'll begin the session with the first question. Dr. Cybus, you said carbohydrates belong to the drug category. That's a big statement. And we all know that. But, as an expert, we want to know why you say this. Also, how do you identify addiction and what can be done to overcome it in short, maybe? But perhaps please begin by making the distinction as to how low carb addiction fundamentally differs from just poor food choices or willpower issues.
So, it's a dichotomy because in impoverished societies where we have a food access problem, carbohydrates very often offer survival sustainability. So there's no question that all cultures have had periods of time where they've had a deficit of access to food. And while carbohydrates are not foods that give you a lot of nutrition, they give you the energy to sustain you through very lean times. And that's a challenge because a lot of our societies have existed or exist, and we humans as a species, because of carbohydrates helping us through lean times. However, for the majority of us now, we live in an era of unprecedented access and abundance to food. And more of the food is manufactured. So it's the pairing of carbohydrates with certain types of food, seed oils, packaging, the rate at which the carbohydrates get absorbed in the human body have gone up tremendously. And the historical benefit of pushing the high that you get from carbohydrates has had a survival benefit where people seek them out in lean times. Well, now we've leveraged that high, and we're using it to cope with emotional need. So it's a driving force that we humans have had for many, many generations, so that we consume that type of food, and now we're leveraging it toward its drug capacity. And we know scientifically that carbohydrates have a similar endorphin activity on the brain as does cocaine, nicotine, alcohol. So it is a very, very powerful instant gratification tool. And in fact, the challenge with carbohydrates, as opposed to the other drugs, is that the negative side effects are not instantly visible. It takes time to develop diabetes, it takes time to develop obesity. So the correlation between consumption, enjoyable consumption, and harm is not as direct as drinking whiskey and passing out and having a hangover. So it is a subtle thing, and you've got to look at human behavior to understand how this works. And then the final piece about the addiction side, sometimes the addiction is expressed as diabetes, as it is in large parts of India. With me in my own personal life and in the US, more often as obesity. So it is a complex thing to understand, but there's no question that people with diabetes, people with obesity have migrated, not intentionally, but vicariously, away from primarily eating food for its nutritional value toward eating food for its emotional management value. And we build a lifestyle around that. We're snacking, we're binge eating, we're always looking toward that next food. We surround ourselves with easy access, no different to the way a smoker surrounds themselves with nicotine.
Yeah, thank you. Thank you for that. So Dr. Cywes, how would you say that, somebody who's, first of all, is there a tool to identify carb addiction? That's number one. And two, how would you, in short, advise somebody who you identify, especially, I mean, in your practice, you may be seeing Indian patients as well, and especially vegetarian patients who are, heavily carb addicted. So what is the transition like, and how do you transition them? Does it involve some clinical, intervention? How is it done?
Yeah, so I think it's a very important question. And let me step back to something else you asked. How do I define addiction?
Yeah.
Addiction, my definition of it is chronic excessive use of a particular substance and behavior to the point of harm,
Mhm.
and then ignoring or distorting the reality of the harm to continue the relationship. So you have to have chronic excessive use, and then you have to have harm. We have use. So if you eat carbohydrates from time to time, they're beneficial. That's enjoyable. There's a benefit to that. Then you can abuse them, where there's no harm, but you overuse them, and then you get to a point of harm. And if you are more than 30 or 40 kilos overweight, if you have type 2 diabetes, those are defined not by something that you did for a little while. Those are defined fundamentally by how you live your life. It becomes a lifestyle phenomenon, and addiction is a lifestyle. So we then have to ask people, okay, you now have type 2 diabetes, maybe you've lost some toes or you've got some heart disease, or there's recognizable harm, because diabetes is just a measurement. It, that's the problem. Obesity, I used to be over 200 kilos, or sorry, 150 kilos, over 300 pounds. So that's visible, but diabetes is not visible until harm happens. Your eyes, your heart, whatever it may be. So, what we have to challenge our patients with is, I know you love to eat this food. I know you think it's healthy for you. I know you're told by a lot of people it's good for you, it's okay, versus the disease that you have. And you can't have both. You can't have freedom from disease and the enjoyment of the drug. If you're someone who loves alcohol and now you've got liver disease and you've got some DUIs, I think you call that driving under the influence, arrests. At what point does your beneficial relationship with carbohydrates become a liability, and at what point do you change? My job is to point out the nature of the broken relationship, and then have them have ownership that it's a problem. Once you own it as a problem, you can then begin. And here's the key difference between diets and addiction. in a diet, okay, you're eating too much carbohydrate, we have to deprive you of your carbohydrates. Diets are very deprivational. You're not allowed to have this, you can't have this, you can't. And one of the things that Anup and Shashi have done so well is they've created an understanding of empowerment. I'm empowered by what I'm going to eat. If I'm going to be eating meat, or if I'm going to be making something that is vegetable but not necessarily grain based. So addiction is about empowerment. What am I going to do? How am I going to make myself feel better? What am I going to eat tonight, rather than looking at what I'm not going to eat? And if you are empowered by what you're doing, and you are replacing the drug that got you into trouble, and you develop disdain for it, that's what we're looking for. So it's a different philosophical management. And I think where the 60-20-20 has worked so well is it's not as absolute as you're not allowed to have any carbohydrates. But
Yeah.
again, if you look at the beautiful dishes, you were talking about all those recipes. I mean, I was salivating over the photographs of how good this food looked, whether it was
Mhm.
vegetarian, whether it included some animal products, um, paneer, or whatever it may be. It looks fabulous, and it's enticing, and you want to eat it. And I think empowerment in terms of what you're doing is important. The other part of addiction that doesn't exist with diets is, as we become more and more users of carbohydrates throughout the day to support our emotional need, there's less and less of a need for other emotional off ramps. We're
Mm.
less likely to be religious. We're less likely to be physically active. We're less likely to communicate with other people. We become imprisoned in our own relationship with the drug. And part of the addiction philosophy is, as you lose weight, or as your diabetes gets better, you develop other emotional off ramps. Physical activity is not there to lose weight. Physical activity is a wonderful endorphin experience. Getting back to a form of spirituality, having human connections outside of just at the dinner table. So the benefit lies not only in the change in diet and getting better, it also lies in the empowerment of self-approval for things that you do, rather than distortion of reality and defending what you've eaten.
Mm.
In other words, if you know,
Absolutely, yeah. Like it's beautifully explained, Dr. Cywes. And I think going by those standards, if you look at the harm that is being caused by excessive eating of carbohydrates, I think maximum people, or the maximum population percentage, would be in that carb addiction group, according to what you've just explained. So that's a shocker. Not really, but a lot of people do need to come to terms with the addiction, which they do not want to admit. I think we'll do a detailed session on this again. But coming to the second question, India is largely a vegetarian country, and as we say, even the non-vegetarians are largely vegetarians because they're probably just adding two pieces of meat, twice a week to their diet and eating. There's a lot of virtue signaling that goes on. One, you have said that veganism and plant-based diets are not human diets. This is your statement. Also, culturally speaking, not historically though, because I can refute that. Vegans and especially a lot of vegetarians deride meat eaters as violent. This is the mental thing that they have for non-veg or meat eaters. How peaceful are especially vegetarianism and veganism? What does the data say? Do you have any data on them? Because I do know the kind of destruction, food miles, plastic, electricity, petrol, and all of that puts food on a vegan plate. But I would want to hear it from you though.
well, I think there is a lot of emotive arguments we can use both ways.
Yeah.
Um, the problem is not really whether you're eating vegetables or whether you're eating meat. And let me break it down this way. There are three types of vegetarians or vegans. You've got your junk food vegans, which are the worst ones. The ones that live on pizza and chips and cake and cookies, and those are the sickest of the vegans, and that really is obvious addiction. Then you've got what I call the white vegetarians, and they're eating what I call white food: the naan, the papadam, the rice, the white starches. And then you've got your green vegetarians, who can actually be pretty healthy. I have no problem, and Anup and Shashi and I spoke about this the last time. I have no issue with people eating mostly green vegetables, but then supplementing it, even if there's a religious barrier to eating animal products, if you're able to eat what I call the renewable animal products, eggs and dairy and paneer, I mean, just to see how Indians use cheese in their cooking is spectacular, and we've incorporated that in some of our own food. So, from a biologic perspective, eggs and dairy are going to give you the full spectrum of healthy fat, of protein, and of the micronutrients that you need for human sustainability. So let's now, the I'm not arguing against vegetarianism at all. I certainly don't want to conflict with your religious beliefs. But if you're able to manage your religious beliefs to incorporate vegetarian, not vegan, dairy and eggs, you're going to be healthy enough. And then letting go of a lot of the white stuff, which culturally is difficult, the rice, the breads, the naans, that kind of thing. However, one of the other things that we've got to understand about a clash between human biology and agriculture, as we have become more commercial in our agriculture, the types of plants that we're planting have been hybridized. And when we talk about food production, and most people will think of packaged foods, foods that are made in a factory. But the reality is that hybridized plants are as much factory produced. This is not natural selection from these plants have been around in the same form for thousands of years. The statement that I use here in the US is that there are no commercially purchasable plants in the US that existed when I was alive. And I'm just over 60 years old. They've all been
Yeah.
hybridized, they've all been managed, and they haven't been managed to be more nutriently rich. So in India, you may still get throwback foods, but if you're going to provide food for the population, you're going to use these hybridized foods that have a greater mass of production. They have greater shelf life, they have greater stability, they have greater transportability. So the food industry has changed the nature of our plants quite a bit, and they've removed the nutrient value. And when I look at nutrient value, if you can consume a minimum of 60% of your food as some form of animal product, or do that on a regular basis, you're getting adequate nutrition in your food. It's always been interesting for me to reconcile, even in some of the vegetarian cultures, the fact that every child is raised on a pure carnivore diet in the first part of its life, when life is when that child's growth velocity is the greatest. The first year of life, we're feeding that child 100% carnivore food, which is called milk or dairy. So, if we can reconcile that, we're doing well. Now, let's pivot across a little bit to the emotive argument of concerns for the planet, concerns for animals. If you think about how we grow vegetables, we have to go to natural soil, natural land, untouched land, completely till that land, destroy the natural flora and fauna of that land, and plant our seeds and plant our plants in that land. Then we come along with pesticides to kill the pests that are going to be eating that food. So, and then when you take that plant out of the soil, you're taking all the nutrients from that soil and transporting it away off to some market. You're not necessarily replenishing that again like a cow would, or like a meat eating or an animal that we grow on the land. So you're not replenishing. That cow eats the grass, poops on the grass, replenishes the land. So the emotive argument about bad for the planet, we're killing animals. Every head of lettuce that you eat has killed way more small animals than any animal that we could possibly eat. So I'm not going to argue with somebody emotively, but don't come at me with an emotive climate argument to support veganism. It doesn't work. The only support for a vegetarian diet, in my opinion, is religious. There
Yeah,
is
and there are so many things that we can talk about. Vegetarian India is a vegetarian country, and we are also one of the sickest countries in the world. Sorry to say that, but I mean the data is not matching up to what we claim. So also the bioavailability of plant foods and all of that. So a lot of things go in there. And it's not just about, virtue signaling about, which you clarified already that, a lot of small ground animals and, birds and ecosystem is destroyed. Forget the food miles and the plastic, electricity, all of that needed to get the food on their plates. So, yes, so that was a brief interjection, just a small question. Let me ask a more important one. What's the role of now I'm coming to carnivore, Dr. Cywes, and also to autoimmune conditions that I primarily handle at dLife. And what's the role of a meat-based diet or a carnivore diet in autoimmune diseases? That's one. Why do you think the vegan vegetarian diet doesn't work long term in most cases? Now, carnivore does, a lot of people do well on carnivore. I have rarely seen somebody, not doing, it may not work 100%, but it does, give you some benefits at least. Which also means, reiterates the fact, that carnivore has the highest efficacy and outcome in an autoimmune disease. Why is that so? And I get a lot of clients saying, I'm a vegetarian and there has to be a way out. I, for one, refuse a vegetarian client mostly unless it's something very mild or, a mild kind of a psoriasis or eczema or something like that. But primarily for ulcerative colitis, Crohn's, all of that, I don't think that a vegetarian diet would work long term. What are your views on this?
But I think it's important to break this up into two separate categories on the vegetarian side because most people don't see the difference. The first issue is pure sugar. And sugar comes in three forms. It comes in pure sugar, which is glucose, galactose, fructose, and it comes a chain of sugar from the plant world we call starch. So your grain products, that kind of thing, refined grains, those are the starches and the pure sugars. And then in animals, we get glycogen. But the pure starches do not cause um, immune reaction. What they do is they cause inflammation in high concentration. So, for example, with diabetes, where you've got elevated blood sugar, let's say you're just eating pure sugar, you've got elevated blood sugar, and there's a certain threshold of sugar in your blood vessels that damages the blood vessel cells, the endothelial cells that line the blood vessels. That is a direct, and that's my PhD, I studied that, where we're just infusing sugar. But sugar is an activator of the clotting cascade and it activates endothelial cells, and the way your body heals that damage is to form a clot. On the other side, when you look at vegetables, and again, particularly the grain products, and the way I tell it is this way. If you think about it, sometimes plants are smarter than humans. Grains are the babies of plants. They're their babies, okay? But the plant can't get up and sow its seed elsewhere. So the plants are very smart. They have to use a mammal or another animal as their intermediary to propagate. And if the plant is successful, it has to entice the mammal to eat that. So we've got wheat. But then if you destroyed the wheat in your gut, the plant would not be able to propagate and the species would die out. It's just the way it is. So what these plants have evolved to do is they give us the benefit of a small amount of carbohydrate, but then the proteins in the plant are very antagonistic to our immune system in the intestine. And so you eat the plant, you get the benefit of the sugar, and you walk down the road, and now your gut is rumbling, it's all inflamed, and you poop it out. The plant is successfully propagated, you've benefited, but at the same time, your immune system has become activated. And the challenge with not just autoimmune disease, but the immune system is if you walk up to somebody and you say, snake, and they get a huge fright and they go crazy and they scream, or if you go up to someone and you say snake and they just, no, there isn't. But if there is a real snake there, you want to take action. So if you think about how we respond to a snake, when someone says snake, if you overreact or underreact, versus if there's a real snake, you move away. That's how our immune system works on plants. What do I mean by that? Is when you eat a lot of grain products and a lot of plants, your immune system is hyper jumpy. So anything that it encounters, it overreacts to it, like you overreacting to the word snake. When you are on a low inflammatory diet, and the lowest inflammatory diet is a pure carnivore diet, a high fat pure carnivore diet. because there are no antigens or very, very few antigens that trigger the immune system. So the immune system is quiet. Both immune systems can react to disease, but one doesn't react all the time. It's quiescent, and therefore it's not attacking you. And that is the anti-inflammatory benefit of carnivore. Whereas if you're eating vegetables, you're reacting all the time, and you cannot separate real disease from false disease or from self-disease. So you're getting inflamed joints, you're getting inflammation of every organ triggered by the immune system that's jumpy. Does that make sense? And we can measure that. So, when you do allergy testing, very few people have a true, real allergy, whether it's an anaphylactic response. But when you test that, you do scratch tests or whatever it is, you see the redness, but the redness is not an allergy. It's just telling us that your immune system is hyper jumpy, it's hyped up. So you take that same person who's got all the scratch tests positive, you put them on a carnivore-based diet, and they, over the course of a year or two, they quieten down their inflammation. In fact, it happens within a few weeks. Now you test them again, and they don't have the same reactiveness because their immune system's ready to go, but it's all quiescent. And a large part of the dietary transition is to reduce the day-to-day activation of our immune system, protecting us from what we're eating. If that makes sense. So that you benefit from what you're eating rather than try to defend yourself from what you're eating. And
Yeah,
the
and
worst
in
of
your practice, yeah, sorry. In your practice, Dr. Cywes, if supposing you got Indian vegetarian with an autoimmune condition, how do you deal with them? And what's your
well, the
advice?
first
And because the diet, I would say, dogma is very ingrained, and a lot of people just refuse to change their dietary preference. If you get somebody like that in a general practice overall, you're handling in your patients as well. So how do you deal with them? And if somebody had an autoimmune condition and were a vegetarian?
so two components to this. The first component is, can we find an adequate spectrum of nutrition in their food that supplies everything that the human body needs? And then secondly, how do we minimize the immune interaction? What I was about to say there is that of all the products that are categorically the worst in terms of triggering the immune system are the grain products. And so if we can eliminate all grain products from their diet, and because it's the grain proteins, everybody knows gluten or celiac disease. 80% of the women that come into my practice have Hashimoto's disease, which is
Yes.
triggered by a grain protein. So the grain proteins historically are very, for the story that I just told, the survival of the plants. The most aggressively immune activating plants are the most successful species. So in those folks, if we can eliminate the grain products and shift them to become more green vegetarian, that is ideal. Then from the nutritional perspective, as I said, and this is what Anup and Shashi have done so amazingly well with all the recipes that they have, if we can not have conflict with their religious beliefs and be able to introduce a small amount of animal products such as eggs and dairy, then we can construct a diet that gives them all the nutrition that they need. So that's the way we can shift it. Still keep them vegetarian, eggs, dairy. If you can get them to eat some fish, that would be ideal. But veganism is not going to be successful in terms of correcting the immune system. Then you have to go a different route, which is to use medication to dumb down the immune system, which in my mind, as a physician who uses medication all the time, that's the worst scenario, is that you consume something that causes a reaction in your body, and then you use a medication to dumb it down.
Yeah, and yet you have all of these vegan groups and vegetarian groups, and people claiming to reverse autoimmune condition, which just baffles me. And I've been saying this, you may suppress symptoms, temporarily, but it is going to come back because you've not understood the mechanism of autoimmune. So you're pretty much, suppressing some foods and eating some, but once you go back to the same style of eating, you're going to get it back unless you understand, what's causing the inflammation. Wonderful answer and wonderful learning there, Dr. Cywes. I'll now come to the next question, which is, the recent controversy of NMHR, the high lean mass hyper-responders who are super healthy showed increase in, I mean, a lot of people I have read about it, showed an increase in soft plaque and non-calcified plaque formation. And CSC score went up when ideally it should have come down. So, please explain this and what does this mean for those who are on pure carnivore, even for low carbs?
Right. So I think it's such an important, again, a dichotomy. The first concept that everybody needs to understand is that human nutrition is very dynamic. It is not static. So if you say, oh, this is what I'm going to eat for the rest of my life, the pendulum may swing too far to one side and then to the other side. And so the first aspect of the carnivore diet, a pure carnivore diet, if there are no religious objections to it, is by far the most effective, rapid way to correct something called insulin resistance. How do I explain insulin resistance? Insulin resistance is, it's a bit like walking up a hill. So if you start out walking on the flat ground, it's easy to walk. That's insulin sensitivity. It's easy. The body tolerates it. Now the incline starts to come. Now you've got muscle, so you can walk up that incline. But it's requiring more and more effort. And we call that early insulin resistance. So you have to put more effort to go up the hill. Then you get to the very steepest part. You get to the cliff, and you can't climb that cliff anymore. And that is complete insulin resistance. Some people have a lot of strength to walk up the hill. Those people can keep walking, and that is what I call the obesogenic part. So they keep eating the sugar, they produce more and more insulin. The insulin turns the sugar into fat, they gain weight, which protects them from diabetes. But eventually, everybody gets to that cliff where they're producing so much insulin, but they cannot produce enough insulin. They don't have enough muscle power to get over the cliff. Now, the sugar builds up in their bloodstream. That's diabetes. The most rapid way, and diabetes is triggered by the consumption of sugar. So that's sugar's a drug, but it also creates insulin resistance, where the body's trying to protect itself from sugar. The most rapid way, if you're an alcoholic, the easiest thing to do is don't drink. It's obvious. Well, exactly the same thing. If you've got diabetes or obesity, don't eat sugar and starch, and it gets better very, very quickly. The seed oils are a part of that and that kind of thing, but the primary thing is the sugar. So a carnivore diet is the diet that is most devoid of consumable sugar and starch. Yes, the liver produces adequate sugar through gluconeogenesis, the new production of sugar, but those rates are adequate. So if you are trying to correct insulin resistance, the fastest, most effective way to do that is to go on a pure carnivore diet where the hill becomes flatter, if I can put it that way. The problem is that human biology doesn't correct things and then stop. It continues to overcorrect. And now, when you're eating pure carnivore, you're burning fat, protein is becoming sugar, you're not releasing insulin. And insulin is a crucial hormone, okay? Insulin is like the wicket keeper, and everybody understands cricket in India. Insulin is like the wicket keeper who controls the field, sets the field, and without the wicket keeper, you're getting into trouble in cricket. It's a bad analogy, but people understand what we're talking about there. So what happens then is you are not over time releasing. So you are not over time releasing insulin because you're not triggering it with sugar. And that is human biology, human intestinal biology needs a small amount of sugar in our diet to trigger a hormone called GLP-1. Everybody knows what GLP-1 is because everybody's using Ozempic or Mounjaro or whatever. But that GLP-1 is produced naturally, and GLP-1 triggers insulin. I know it's a little bit of science. So if you overcorrect, now your liver is producing sugar, but you now have no insulin to clear the sugar. So again, the sugar builds up in your bloodstream, same as insulin resistance, except now you're insulin suppressed, you're not producing it. And as that sugar builds up, in people who are diabetogenic, who have a vulnerability to diabetes, now you're activating the endothelial cells as if, so instead of climbing up a mountain, you're now running downhill so fast that it's a problem. If I can go back to that analogy. So in those people, their blood sugar builds up. And people who are long-term pure carnivore, they're not producing insulin, and we see rising blood sugars. And those are the people that get the same cardiovascular disease. So there is an inflection point where the carnivore diet, pure carnivore, has done everything it can do to correct you very rapidly. And then there's a brief period of time where you're in the best shape of your life, but then you begin to deteriorate. And as a physician, what I'm able to do is to look at your blood work sequentially and determine where that inflection point is, and then slowly introduce a small amount of carbohydrate, not as an energy source, but as a trigger
Yes.
for the release of insulin. And
Yeah.
that is, so the ideal diet for me long term is called a carnivore based diet,
I
where
was going to come to that. In fact, that's very interesting. Laid a lot of stress when you say that you are carnivore based, but not a strict or a pure carnivore. I think this is a very good reasoning and logic to that. And I think in that context, maybe you can carry on and just explain the concept of what you call physiological insulin suppression.
yeah, so it's interesting, and now that we've got ChatGPT and other things, you can just go there and corroborate what we're dealing with. If you look at a pure carnivore animal like a lion or a wolf or an eagle or an alligator, their biology allows them to trigger the release of insulin through amino acids, which are the breakdown products of protein. So they eat protein and they release sugar. And they release insulin, which then takes the sugar that they've produced from meat in their own livers, and it can push it into their muscles. Humans, only about 20% of our insulin production is released in response to amino acids. 70 to 80% require sugar. So at first, when you're correcting insulin resistance, you've got too much insulin, you don't need any sugar triggering. You're trying to diminish this massive tsunami of insulin. But once you get to a point where insulin release is adequate, and then it becomes less than adequate, you have to re-trigger that. And that's where sugar comes in. Now, if you want to stay pure carnivore, human milk, has sugar in it at a high concentration for a specific reason to trigger insulin. What's interesting, Ira, is if you look at the milk from a lion,
Yeah.
it has almost no sugar in it.
No sugar. Yes. You've talked
If you
about
look,
it. I've heard that. Yeah.
right, if you look at human milk, it's got a very high level of glucose and galactose. Why? Because our biologies are different, and that
Yes.
baby needs that bit of sugar not for fuel, but to trigger insulin, because they're living in ketosis. So you can reconstruct that insulin with dairy. But you can also introduce certain other limited carbohydrates that are sugar, but not vegetable products if you've got an immune system problem. And there was a beautiful study done by a woman by the name of Isabella Cooper in Oxford. And she looked at a group of women, all fat adapted, ultra low carbohydrate diet. And she looked at their diets, and looked at their blood work. It was fabulous. They were all eating between 50 and 75, a couple of them up as high as 100 grams of carbohydrates a day, not as a source of energy, but
Yeah.
specifically for this.
It
So
just makes me wonder, Anup saying this all the time. I think he started saying this in 2011, 2012, that nobody needs to be in keto if you do not have a reason to be in keto, and especially for mental health cases and all of that. So even now he says, you do not need to be in keto, and we get this all the time. People in D life, trying to do keto and just going on carnivore, which have also said, nobody needs to be a fanatic. For me, Dr. Cywes, you would be amazed to hear this. I was diagnosed with membranous nephropathy and advised kidney transplant by the doctor 6 months down the line. And he asked me to be ready for that. And I had no direction back then. And I was a vegetarian, by the way, for 10 to 12 years. I turned carnivore. So I keep saying that unless you have a medical reason for that, unless you have a very valid reason for that, you don't need to be a fanatic. And if you want to eat dairy or, any amount of small amount of carbs, you can do that. So it's so very relevant, and, so good to hear you talk about the same, that Anup talked, also long back. So please continue on this. Would want to
Right.
hear
So
more.
I think that's the genius of Anup is that 20, the 20 that is carbohydrates. It's
Yeah.
adequate to trigger insulin,
Correct.
but it's inadequate to over trigger it.
Yes.
And that is the genius of 60-20-20. You're getting your protein in the right amount. You're not getting too much protein. You're increasing your fat, so you're becoming fat adapted. So I prefer the word fat adapted to keto because it's where your body preferentially uses fat. It doesn't just have to be in ketosis. In fact, the human body is typically not in ketosis when you're eating once you're in a steady state. But the 20% of carbs is adequate to trigger insulin without causing harm. And that's why we see the correction of the diabetes. So you're absolutely right, is the evangelism toward vegan, the evangelism toward pure carnivore are problematic. But here's the issue, Ira, is that both veganism and pure carnivore will correct health issues because they're
Yes.
elimination diets. They
Mm.
both correct health. But the
Mhm.
question is, where's the middle ground that is sustainable for the next 40
Right.
or 50 years of your life?
Right.
And that's
Yeah.
the key thing, getting adequate nutrition in. The other part also for me, so who, which we haven't discussed yet, is the human biome. And what the biome means is the bacteria, funguses, viruses in the intestine. And there are really two populations of biomes. One is more associated with vegetarian animals, which ferments vegetables. So if you think about kimchi or sauerkraut, that's ferment. I don't know if India has a particular fermented vegetable, but if you've
Yeah,
got a
it
name,
has. In fact, it has a lot of pickles as well. I mean, we have a tradition of eating pickles, which is nothing but, marinated in spices, which you call marsala. It is masala.
I
It
know,
is
I put the
masala.
R in
Yeah,
there.
and some mustard oil, because mustard oil is considered medicinal, which I agree to. It's not for daily consumption, it is medicinal. So
Yeah.
traditionally, they used mustard oil and a bit of spices to pickle things up, and it was sun-dried. So yes, we do have a culture of, fermented foods, but besides that, also people now are eating a lot of fermented carbs as well. Idli, dosa have been traditional foods as well. Yeah.
Right. So the ferment, but and I appreciate that. I'm sure that I was pretty certain I didn't know the name of it, but in India you have your own fermentation, like the Koreans
Yeah.
and the Chinese have their
It's called
their
achar. It's called achar,
achar.
Dr.
Okay,
Sykes.
I know what achar is.
Achar.
Okay, okay,
Yeah,
yes.
pickle.
So that is a process that
Hmm.
human beings have lost
Yes.
in our intestine. Cows can do that, gorillas can do that. The pure herbivores can ferment food in their stomachs that are these big fermentation vats. Humans have lost that ability. So when we have a biome that is consistent with plants, the fermentation process is not beneficial in our intestine to the absorption of nutrients. The fermentation process occurs in our colon. Now, the human colon doesn't absorb anything other than water and salt. So we've got this big vat in our colons that ferments the plants that we eat to make it into the bowel movements that we have. However, that fermentation process acidifies the colonic environment, and the acidification, that fermentation process, breaks down parts of the colon. So we're getting diverticulitis, we are getting cancer, huge rise in colon cancer, especially when there's a lot of carbohydrates mixed in, because as you know, when you're making alcohol or whatever it is, you use the sugar fermentation to create those poisons. So that's the process that's happening, and it's got a biome that is associated with vegetables. So if you're taking probiotics, they're vegetarian associated biome. On the other side, the way carnivores process their food is carnivores process our food through enzymatic digestion. So we use enzymes to process our food, and it breaks the food down. And there is a different biome that is associated with enzymatic digestion. So, for example, if you look at cheese, blue cheese, or you got that little blue vein, those are the funguses and the viruses and the bacteria that are associated with a carnivore-based biome, and that is immunologically a very quiescent biome. So, for people with irritable bowel disease, with inflammatory bowel disease, Crohn's disease, ulcerative colitis, a pure carnivore diet changes the biome And as far as we're aware, the inflammatory bowel disease is caused by your own immune system reacting not only against the proteins in the plants, but also against the bacteria, fungus, and viruses that are part of a vegetarian biome. And if you've got irritable bowel, if you've got acid reflux, all of those are triggered by carbohydrates and by that biome. So the benefit of carnivore is changing the bacterial environment in your intestine that is lower in inflammation, lower in triggering your immune system, and more conducive to the enzymatic digestion of food. So there's a lot of things that we have to be able to break down in terms of understanding the benefits of a carnivore diet. It's not just the nutrients. It also regulates your hormonal system and it regulates your immune system. So those are the benefits that we have by being mostly carnivore or carnivore based.
Yeah, and you advocate about, being in and out of ketosis and not in that state forever. And that's why, this the mention of carbs and the 100 grams is so relevant. So we'll probably come to the
Well,
next
let me
question.
stop you
Yeah,
for a
yeah,
second, Ira. Let me stop you because
yeah.
the other thing that dLife does, which I don't think is as, it's a brand. The 60-20-20 is a brand, but there's something else that
2020-60. 2020-60.
okay, so yeah, okay, so I call it the 60 fat. That's but 20
Yeah,
60. Okay,
yeah.
yes. Let me correct that in my note here. But what we're talking about is 20% protein, 20% carbohydrates, and
Yeah.
60% fat. But
Yes.
there's something else that
Huh.
is as strong, equally as strong a message, and this is crucial for people to understand, and that is the so-called intermittent fasting. And what Anup has also done is created an eating window and then a not eating window. And so if you look at a herbivore, a plant-based animal versus a carnivore, herbivores are grazing and eating continuously.
Continuously,
Okay.
yes.
However, the difference is this, the true herbivore animals, and just think this through, they've got these massive stomachs, and the contents of the stomach is outside of their body. The inside of your intestine is outside of your body. So they're eating continuously, they're replenishing that, and they're slowly absorbing food continuously from that stomach. But even cows are turning with their bacteria, turning the sugar in cellulose, turning it to fatty acids. So what a cow is absorbing is actually fatty acids, even though
Mm.
they ate sugar, because it's the process in the gut that's creating those fatty acids. When you feed a cow a lot of grain products, or a herbivore a lot of grain products, it can get diabetes. That's how we fatten cows up. Okay, we trigger insulin resistance in the animals before we eat them to fatten them up. Okay, no different that happens in humans. And if you do that over a long period of time, those cows get sick. In humans, we don't have that ability. So we don't have the ability to store food for a very long time. So we are more along the lines of carnivore animals that have a big meal every now and then. And the human biology has to go through, the ideal human biology goes through three phases every day. The first phase is a storage phase where we process that food, we absorb that food, all that food goes to the liver. But when food goes into the body, it is broken down to its individual building blocks: amino acids, glucose, galactose, fructose, and fatty acids. We're not absorbing apples or spinach or a steak. We're absorbing those three basic building blocks. Under the influence of insulin, human growth hormone, testosterone, even in a female, and thyroid hormone, we rebuild and then distribute that food for storage to the cells of the body. So there's a period of time during your eating window where the cells are absorbing food. And then if you don't eat out of that window, that 6 to 8 hour window, now your cells get to a place where they start demanding energy. And we see those four hormones falling, and we see another hormone called glucagon rising. And glucagon's job is to release stored food from the liver at first in the form of sugar, and glucagon makes new sugar in the liver. So the cells under falling insulin, rising glucagon, take up some sugar, which is the second phase, which is glucose utilization. And both of those stages, you don't have to be in ketosis. But then the third stage, once your liver is empty and you've not eaten, now you get into fat utilization. And in order to release fat from your fat cells, You have to have low insulin and high glucagon. And the key thing about fat utilization, that's where all the good things happen in the human body. That's where autophagy, or the breakdown of old dead cells, happens. That's where tissue repair, mitochondrial repair, your brain cells get repaired. And that is where cancer surveillance happens. That's where your blood sugars tend to fall because you're compensating with a burning of fat. So that is ideal where you get into ketosis or burn fat, but it's a block of time. Now, if you are snacking and eating all the time, you're all the time in storage phase. You never get into that utilization phase. So your body doesn't have the opportunity to repair itself. By the way, in that fat utilization phase, that's where immune system comes down. So one of the things that you did with your nephropathy is not only did you take the immune inflammatory pressure off your kidneys, you probably also started to cycle so that your kidney could also repair itself in an
Yes.
anti-inflammatory environment. And
Correct.
that's why Jason, my friend Jason Fung, was so good when he introduced intermittent fasting. It's logical, but it really is an excellent way to go. And in fact, just a little anecdote. Jason Fung developed, he's a nephrologist, a kidney specialist who
Yeah.
works in Canada. And he had a lot of folks from India, from Southeast Asia. Now,
Mm,
slightly different cultural perspective, but they were Muslims. And they
mm,
wouldn't stop eating their carbohydrates, but they did do Ramadan. And intermittent fasting is based on Ramadan as a protracted period of time where they didn't eat. And that's what he used for his diabetic patients that had kidney disease. And it became something in 2010, 2012 that you then introduced to the world. So you've remedied yourself not only by not triggering your immune system, but by also allowing your kidneys to repair itself. And that intermittent fasting is as important as a change to diet.
fantastic explanation there, Dr. Cywes. Two questions are there from Anup. I'll ask this one first. What's your experience on urea elevation one on carnivore diet on a population level that you have worked with or experienced? At what levels of these one should be concerned and tweak protein intake?
So, you know what's interesting is that the human body has a very limited capacity to process protein. And if you look at pure vegans and pure carnivores, there's not that much difference, maybe 25, 30% here, maybe 10 or 15% here. But the protein consumption is relatively static. Zoe Harcum, a PhD nutritionist that lives in the UK, brilliant, brilliant woman, she kind of did a lot of this work, but there's not that much difference in the protein consumption. Where the biggest difference comes in is your percentage of fat versus your percentage of carbohydrate. And it's exchanging carbohydrate for fat. If you look at the average diabetic or obese person, 70 to 80% plus, sometimes as high as 90% of their total calorie consumption is sugar. And if you can exchange that, that's where the 60% fat comes in. You're reducing that from 80 to 90% down to 20% of your diet is carbohydrates, and you're compensating with fat. You're not compensating with protein. So, on a vegetarian-based diet, the one of the challenges is chasing fat and chasing protein, getting enough in. On a carnivore diet, what you always want to do, and the phrase I use, is to protect your protein with the consumption of fat. And fat suppresses appetite. Fat suppresses appetite. So it is a very, very useful way to reduce how much you're eating because the quality of the nutrition is so much better on a carnivore diet. But the challenge with the human body is that if you overeat protein, and it's again a bad messaging. Oh, you must eat 1 gram per kilo, whatever. Nobody knows how much you specifically need or I need, and nobody knows on any given day. And if you're doing the same every day, you're doing a disservice. So the problem with protein is there is no store in the human body for protein. So the liver has to take excess protein, turns it into sugar, and then if that excess sugar is not used up, you turn it into triglycerides. So we're talking about the lean mass hyperresponder study. A lot of them are eating a ton of protein, and you start to see the BUN. BUN is a measure of how much of your energy is coming from protein because we can measure the nitrogen. Uric acid is another one, and creatinine is the other one. So those are the three numbers that we can look at for protein. But AST and ALT, two enzymes in the liver, aspartate and alanine, the two commonest proteins that get turned over by the liver into sugar and then into fat. And we can look at triglycerides as well. So I can look at all that blood work I don't know how much protein you need, but I can tell you if you're eating too much, too little, or just enough by looking at the relationship between those numbers. But I think the other thing also, one of the issues with the carnivore diet is the promotion of protein, protein, protein. No, it's protein with fat. And one of the issues then with the overconsumption of protein, because we don't have the insulin, is you see the rising blood sugars. So what most people don't understand is how incredibly resourceful the human body is. And the way I compare it, and I think India is a great example relative to the US. Here in the US, we buy a product, and when it gets damaged a little bit, we throw it out and we buy another one. In India, like in South Africa, folks will take those products and repair them and reuse them and recycle them. The human body is a bit like India or South Africa. It recycles stuff all the time. So when we're breaking down old dead tissues, we don't just discard them. We break them down into their building blocks and reuse them. So the majority of protein in the human body every day is recycled. And all we're doing when we're eating is topping up a tiny fraction of what we need. But we live in an era of enormous abundance, and everybody way overeats. And that it's the overconsumption of not just protein by percentage, but protein overall that can also cause problems down the road, even in carnivore patients. One of the interesting things about eating, and it's a little analogy that I talk about. I don't know if you have any children. I don't know if you breastfed children, but if you take a little baby, and inherently in that baby's system is a signal that it's hungry, so it's crying. So the mother puts the baby on the breast. The mother has no control. The baby begins to drink, and there's a lot of fat in the milk. So the fat triggers a hormone called GLP-1, the same one we talked about that triggers insulin. It
Yes.
also is triggered by saturated fat a little bit later, lower on in the intestine. And that GLP-1 signal goes back to the brain and switches off, it controls hunger. So that's why when we're eating a carnivore diet or a high fat diet, even on a vegetarian diet, if you add fat to your food, it switches off eating very early on. So
Very.
that baby will then eat a lot or a little bit, but it's
Mhm.
always exactly enough. When you take the same baby and you take breast milk and you put it in a bottle, and now some genius out there told the mother, this is how much milk this baby needs. You must feed the baby 12 ounces of milk. So the mother, a good mother, will plug that baby in, and come hell or high water, that baby will drink that amount of milk, irrespective of the signals from the belly to the brain. And at a very early age, we get conditioned to eat what's in front of us rather than allowing our belly and our body to tell us how much we're eating. One of the reasons why these people are taking GLP-1 and Ozempic is because it suppresses appetite. It's just recreating that biofeedback response. So on the carnivore diet or even on a vegetarian diet, if you can use a high amount of fat to create early satiety and then trust the fact that you're going to eat enough, even if it seems like very little, your body's going to be just fine. And there'll be days when you eat more, days when you eat less. But this is where the diet mentality is so wrong, because they have a measured amount as to how much they think you should eat. And if you're a
Yeah.
good dieter, you're going to eat that amount. No, there are days when you can have a little bit, days when you eat more, but you want to eat sequentially and allow your belly to dictate how much you're going to eat, not your brain telling your belly how much it's going to get.
Yeah, and the key word here is satiety. You talked, so well about the fat and all of that. The first word on my diet protocol is eat to satiety. I think you've made fantastic sense, and you've, just, further ingrained in me what I've been doing so far. And I've always advocated for fatty meat, very fatty meat, and that's the way to go. And you will often see, the benefits, like if you're trying to control fat, if you're trying to probably count calories, if you're trying to measure food and eat, or focusing too much on protein, you're going to miss this element, I think. So wonderful learning there, Dr. Cyrus.
Yeah,
Um,
fat protects you from overeating.
Correct. Correct.
And
And you
the
see
other
the
thing,
difference, Dr. Cyrus, you've seen the difference when you eat fatty meat versus if you eat chicken and if you eat, just seafood, or seafood is still better, but chicken, if you compare with fatty meat, you will see the clear difference, of how fat works, basically.
right? And I call so we use fat as a condiment sometimes. So if I look at a
Mm,
piece of food and I can see visible fat, that's okay. But
mm,
if I'm looking at my food and I can't see visible fat, there are certain condiments that we can use depending on how you enjoy food. But
mm.
butter, eggs, cheese,
Eggs, yes.
bacon, and then the small fish, sardines, oysters, clams, mussels, that kind of thing, they add fat to the food. If
Mm,
you're on the vegetarian side, olive oil, coconut oil, avocado oil are reasonable oils because they're cold pressed. Now we can get into the whole seed oil thing, but you want to stay away from the
yeah.
hydrolyzed seed oils. But if you are vegetarian, those three oils, nothing is perfect, but they're about
Mm.
as good as it gets in terms of being anti-inflammatory in your food. And even if you carnivore, you can still use those oils from time to time as cooking oils. They're far better than any of the seed oils that we so commonly use.
Okay, time for some myth busting. And I think um, as much as we've talked about him, it's still so less. People come with these, confusions and fear all of the time. So probably just a short explanation on all of these, Dr. Cywes, coming from you, it would matter. Fat causes fatty liver.
Absolutely not. Absolutely not. The conversion of sugar to fat causes damage to the liver and also causes fatty liver. So we know that sugar, for example, in the heart, where it's everybody's obvious, causes inflammation of the heart. In my PhD, we infused sugar into livers at a human concentration, at a high human concentration, and within 3 hours, I created visible damage to the liver's blood vessels, to the sinusoids, the liver's blood vessels, and then we could study the clotting cascade in the liver. When you infused fat, nothing, no reaction whatsoever. So in my PhD, I demonstrated that, I proved that. But the fat in the liver is manufactured by the liver, and the liver's job is to protect you from excess sugar by turning it into fat. And you can measure that in triglycerides. So absolute fallacy. And the
Yeah.
same thing then is if you want to fix a fatty liver, get rid of the carbohydrates within a week to 10 days. Fatty liver goes away. And as a surgeon, I've biopsied over 1,000 livers just looking at that. And we can get rid of fatty liver, at least the fat in the liver, within a week to 10 days of not eating carbohydrates. The fibrosis, the inflammation takes a little bit longer to go away, but
Correct.
absolutely wrong philosophy to think fat causes fatty liver. By
Bang
the
on.
way,
That's, yeah.
Ira, in human biology,
Yeah.
longer chain fatty acids don't even go to the liver. They go up the lymphatics and go straight to the fat cells. It's only the very short chain fatty acids that go to the liver. So that's a completely biologically false notion that fat causes fatty liver.
What about high salt? High salt is, in fact, say 8 grams or, 10 grams and all of that. High salt is bad for the body. It's especially poison for people with hypertension. This is the
Well,
fear.
it's about right. And I hear you there. It's about perspective. The When you eat sugar, sugar is very hydrophilic. So if you've got a six carbon sugar molecule, it's got six molecules of water attached to it. When you eat sugar, the sugar sucks the water up into your blood vessels, into your cells, but then the sugar gets disappeared. It gets turned into glycogen, it gets turned into fat, or it gets used as energy. Now you're left with all this excess free water. And that swells the body, causes elevation in blood pressure. So, along with high sugar diet comes high blood volume, high tissue volume, swelling of the joints, and that's a trigger for inflammation. The human body, when you pee, when you sweat, when you remove fluid from your colon, we don't pee water. We pee salt, and the water flows down gradient to salt. When you sweat, you don't sweat water, you sweat salt, and water eliminates that way. Salt does not get destroyed or altered. Salt is an element, it doesn't get destroyed. So when you eat a lot of salt, the human body can then eliminate that salt and eliminate the excess water. So the problem in healthcare now is everybody focuses on salt as being a problem because yes, salt will retain some fluid, but nobody talks about sugar. Sugar
Correct.
plus salt is a terrible combination, but the problem is sugar, not salt. So if you're on a low carbohydrate diet, you need a high amount of salt to eliminate water. And the human body has three wonderful ways to get rid of sugar. The first, to get rid of salt. The first one is you pee it out, you sweat it out, and you poop it out in your colon. So we have wonderful ways to eliminate water using salt. And historically, a high salt, low carbohydrate diet is the healthiest human diet for your blood pressure. And most
Yeah,
carnivores are
and
going to.
then just recently, Anup was admitted to the hospital for a day because he had some knee injury. And he got, questioning the doctor because the first thing, as we all know, when you are in an ambulance or you reach the hospital, is the saline water that they give you. I think it's 9 grams per liter or something of salt that is
Yeah.
given to people. And yet, the fear of salt and people with hypertension, especially. So great, you clarified that. What about
Don't be
vegetables?
afraid of salt. Be afraid of the
Yeah,
sugar.
yeah. What about vegetables having nutrients? What about the bioavailability? How essential is it to eat vegetables and fruits as well?
Well, the first thing let's counter: the human body does not need fiber. It is unnecessary. Fiber is a replacement for the lack of fat in our diet. So the two things that help animals to poop: fiber, cows, that kind of animal, or fat, which is your carnivore animals and folks like humans. So if you think about it, breast milk has no fiber in it.
No fiber.
If fiber
Fiber
was
is not
necessary,
even a nutrient.
correct, it's not. It is not. And fiber will become fermented and acidify in the colon. So that biome that we talked about earlier on. But so the fiber I just want to eliminate. You don't need fiber. If you're struggling with fiber is helpful for bowel movements, but it's not necessary. Fat is your essential thing. The next thing is that the amount of vegetables and the range of vegetables we have to eat to get adequate protein, to get adequate fat, to get adequate trace elements, minerals, vitamins, trace elements, is extraordinary in terms of the volume. And most people cannot eat adequate volume in terms of nutrients. And we're talking mostly about the macronutrients. So with all due respect, if you look at a lot of Indian folks who are vegetarian, they have, and especially the men, there's a photograph I saw on Instagram a little bit ago of smaller arms and then this
Yes,
belly that's out
belly.
here.
Yeah.
So they are protein energy or protein deficient, but energy overloaded, if that makes sense. And
Overfed and undernourished, as you would say.
correct. So what's happening there is the human body needs protein turnover. And if you are not replenishing protein adequately with your diet, then you're going to steal that from your own muscles. And the muscle wasting, for example, in people with on Ozempic or Mounjaro is exactly due to that. It's due to a lack of protein in that they're eating. So if you're eating lettuce leaves and Oreo cookies, you're going to suffer with a lack of muscle. So that's part of the problem right there is the protein turnover, the protein consumption. Now, can you get adequate protein on a vegetarian diet? Yes, you can, but it's going to come from things like beans and lentils and that kind of thing. So it's difficult. It's much more difficult to sustain nutrition adequately on a vegetarian diet. And then on top of it, because of the manufacturing of our commercialization and hybridization of our plants, we've eliminated a lot of the other plants that were high in nutrient value. And that is a big problem. They haven't hybridized for better nutrition. They've hybridized for non-biologic benefit reasons.
What about egg? Egg raises cholesterol. This is such a fear. I mean, we encounter people who are vegetarians, and after giving them a kind of lowdown on why they should introduce eggs. The fear is this that it raises cholesterol, and a lot of people start with me, just going with egg whites when it's written clearly and explained clearly, whole eggs. So kindly, probably just bust this myth.
Well, first of all, a whole egg is probably the healthiest micronutrient, macronutrient product you can eat because you're basically eating a whole chicken. The only thing you're not getting in is the calcium, and you can get that from your dairy. So eggs include, and all the benefits on the yolk. The white is just protein. The issue with cholesterol is this: the human body produces cholesterol not to kill you, but because it's necessary for your cells, and every cell requires cholesterol. The human brain makes its own cholesterol, And especially the brain and the nerves need huge concentrations of cholesterol. So what's happened over time is through industry protecting itself, particularly the tobacco industry, they blamed fat in our diet and they blamed cholesterol for causing heart disease. Now, cholesterol is implicated in heart disease, but cholesterol is responding to inflammation. It isn't causing the inflammation. So there's two philosophies. The industry-sponsored philosophy is that lipids cause harm, which means that God or nature put a kill switch in your liver and said, okay, when you're 55, I'm going to kill you by flipping the switch and making your cholesterol kill you. The human body doesn't work that way. That cholesterol is biologically necessary. The damage comes from the sugar that is causing the inflammation. And it's the inflammation that is trying to be healed by packing down the cholesterol. But altering your cholesterol number is not going to affect what happens, because it doesn't matter if you've got a lot or a little, there's inflammation, it's all going to respond. Does that make sense? So the
Yes, sir.
challenge there is understanding human biology, and cholesterol is necessary. If you look at a lot of older people who have diabetes, who have obesity, they start getting cognitive impairment because their brain cells are not able to repair themselves or them because they don't have adequate cholesterol. And then if they're on a statin, which is a cholesterol lowering medication, you accelerate cognitive impairment because you're dumbing down cholesterol. So we blame cholesterol that is vital for every cell in the body because of what it does to our blood vessels, which is erroneous. It's a
Mm.
false narrative, and we are rapidly changing that narrative in the US.
Yeah. So one last question, Dr. Cywes, how important are fruit consumption? Because Indians rely heavily on vegetables and fruits, and it's a big virtuous thing, mothers packing fruits in their, lads' tiffin and all of that. So, just kind of a reality check from you.
So I'm going to say something that may sound a little blasphemous, but I'd far rather somebody eat fruit as their source of carbohydrate than the grain products.
Yes.
The fruit tends to be, I would not rely on the fruit as a source of nutrition, but if you're going to get pleasure from carbohydrates, get them from fruit, not from
No, but
packaged
here
processed
we are
food.
talking about a food scarcity environment wherein you can take some fruits, right? But when you
Correct.
are
But
having
even if you
excess of carbohydrates and then having fruits, how does it work?
That's the problem. So it's one or the other. So you look at a guy like Paul Saladino, who was heavily
Mm.
carnivore, but he became very insulin suppressed. So he's turned to simple sugar like honey and fruit, maybe a little bit too excessively, and is not having that much damage. So if you look at your 20% on the 20/20/60, and if a large part of that is coming from fruit, you're okay. First of all, the fruit doesn't have the pro-inflammatory products that the grain products do. And the fruit is enjoyable in a small quantity. So if you're going to be part of that 20/20/60, I have no problem with you using. In fact, I prefer that you used fruit to the grain products. Now, if you're going to do the fruit, the other problem that we have is fruit is typically seasonal. But in our current global economy, you can buy an apple every hour of every day at any store. So it's not just a few months of seasonality. So if you're going to eat fruit, maybe focus on going back to the seasonality of that fruit. So, mangoes are going to be around for a particular short period of time. And if you eat them during that time as a treat, as something that is enjoyable, a little bit like I may have a glass of wine. I'm not going to drink wine when I'm dehydrated. I'm going to drink water. But for fun, if I'm with friends, I may have a glass of wine.
Yeah.
If fruit occupies that role in your life, it's limited. You're getting the benefit, the enjoyment of it without the liability. And if that conforms to your 20, that's fine. I personally don't trust myself with fruit. So it's a trust issue. Once I start, I can't stop.
Yeah.
And I do drive-bys. If there's fruit in my fridge, I'm going to drive by and grab a little bit, grab a little bit. So I recognize that my personality is best without fruit in my life. Not because
Right.
fruit's good or bad, but I
Mm.
can't trust myself with it. And a
No,
large
but
part of
it does create a frenzy to eat more fruits. I mean, fruits do that to
absolutely.
you.
Absolutely. So,
Yeah.
if you're going to eat fruit, eat it in your eating window. Don't eat it outside of that. Eat it
Mm.
earlier in the window. And perhaps you might create a rule that I'm not going to have fruit in my home but when I go out, I may eat some fruit. So that you're limiting the fruit by virtue of your access to it, if that makes sense.
Yeah. Seasonal and very occasional, I would say.
Yeah.
Yeah, well, with this, I come to the end of a blast of a podcast with Dr. Cywes. What a pleasure it was to host you, Dr. Cywes, for the first time on dLife podcast. I know there's a lot to, ask and a lot for you to answer as well. I think we will schedule another one, but I would want Shashi and Anup to come online and probably have a word with Dr. Cywes and, thank him for this absolutely fantastic podcast.
No, thank you very much. And great questions that you were
द-
asking. And I think
वो 10 मिनट में
what I
कर
love
देते
about this approach is it's not evangelical. It's not must do this, must do this.
Must do
It
this, correct.
is giving
Yeah,
folks options.
yeah,
Very,
yeah.
very impressive. And
Dr. Cywes, thank you very
yes,
much. I think Anup is traveling.
thank you, Dr. Sayas. I'm still traveling. Just another 15 minutes. I'll be reaching my destination. But I was all online all through, off audio, off video, but was listening to wisdom that you were trying to. I mean, you have been passing on, and we'll, as Ira said, we'll have you maybe 1 or 2 sessions more, and with very very specific topics that we can discuss before we come. So thank you for your time, and it was
this
a
is
pleasure.
always an honor for me to do this because it is a very pragmatic approach to nutrition and human behavior. It isn't one size fits all. It is a dynamic, as I said, it's a dynamic way of doing this to meet people where they are, not where you would have them. I love what you guys have done, and it seems clearly to be working. The greatest challenge is to get this knowledge in front of more people.
And I
Thank
think
you.
we have ample cases where people have followed the diet for, see me following almost 10 years and Anup for more than 14 years. We have one more Arun Kumar here, more than 12 years. And we have some clients who have been following this for 3, 4, 5 years also. To a fairly good level with minimal medication or possibly no medication. I think we are making some
It's,
inroads somewhere
just
and
to add to
yeah.
What Shashi said, Dr. Cywes, Anup says that once you see the benefits of low carb or the magic of low carb or 100-gram carbs per day, you cannot unsee it. I think I have been personal benefactor of this, and all people who have been with me with Shashi, and they've done extremely well. For them to, conquer off the diet is not very easy because they're enjoying it as well.
Hello.
So yes, you're right about meeting them
Hello.
where they are instead of being a fanatic.
Exactly.
Yeah.
Thank you.
सुसाइड दे गया मैं
Thank you, Dr. Cywes.
अभी
Thank you very
अभी
much.
करवा के भेज रहा हूँ
No, thank you
तो
very much.
Thank you so much for coming. And I think I'll end this session. This is Ira Sahay signing off. What a pleasure to have Dr. Robert Cywes amongst us. We'll schedule another one specifically to talk about his carb addiction because it's very pertinent to India. Thank you so much for coming over and speaking to us. This is Ira Sahay signing off. Bye-bye.
Thank you.
thank you, doctor.
Did we take a screenshot?